It's a small town feel, where you know who your city council people are. They come to our events, they know the staff by first names. I think that that's one of the things that really makes DeWardy a really great city. I would say that our city leadership is very in touch with the young people in the city.
We do have a lot of retirement people around the community, and I know lately they have been focusing on youth and trying to get programs run here, because with our schools and our districts, we have a lot of students who are going to outside districts because this is becoming a retirement community. The community is a really good community. They work together, and we also have City of Hope, who also works with a lot of our students too, to try to instill the science program with them as well. So there's a lot of stuff going on in DeWardy. It's just a matter of people taking advantage of that. The kids who go to school here from a young age, I feel like this is their home, this is where they want to stay. So having the adults realize, okay, that this is kind of becoming a retirement community, and then working hard and try to have more youthful events, that's a good thing. And that the students here are kind of excited and proud to be from DeWardy.
There's a lot of activities for the kids here. There's a lot of weekend kind of family get-together, stuff like that. So that's one of the things that we like about it. They have food festivals. They have kids programs, like arts and crafts, stuff like that. They have sports events, kind of showing them a little bit about different sports. I enjoy being here.
Our boxing gym is at capacity. And so that's another challenge for us. We probably get anywhere between 40 to 60, 70 boxers in that gym daily.
Oh, wow.
Yeah. And, we have other people coming over from other gyms, and so that creates, more people in that space. We currently have, on the nice days, our kids are in the park. They're jumping rope right here in front of the building. They're in the hallways. They're, and so being able to possibly expand, our boxing gym is something that, we've really been wanting to do for a very long time, so we're hoping that at some point, additional funding would come along that we would be able to do that.
Well, I heard that they had a boxing gym here. I grew up here in DeWardy, and I was interested in maybe trying to start to get the boxing program going. So that was, I think, 11 years ago. It was going on a few years before I got here. We've had several of our boxers travel around the world to compete in events and world title fights. We train 5 to 6 days a week. I think we're averaging probably between 40 and 50 boxers a month. And it is a good program for a lot of these kids are kind of at-risk kids, and the boxing program is great for them.
Like the camaraderie you build, you got people here they motivate you in a different way to push yourself. In there, it's not just 10 reps. You get hurt, you gotta stick it out for the rest of the round.
So it's kind of like the dad is the head coach and the really loud uncle is Louie, our technical coach. I travel to Tahiti every year to fight, New Zealand, Mexico once, all of them around the United States.
Yeah, it's like where I grew up, a lot of people went the wrong way with that and just kept me out of trouble. So those 9-10 years I was here, it showed me a different way, a different way of life, stay out of trouble.
This is where we started. This is what turned our negatives into positive, where I got kicked out of high school for fighting. I broke this girl's nose in high school, and she's like, I put you in boxing. You're done with volleyball and basketball. That's not what you're meant to be. She's like, you're going to be something. It's our own therapy. We don't need a therapist. This is our therapy. That's great.
75% are Hispanics, low income, and maybe the other 25% is mixed between, white American and Asian Filipinos. So some, how to teach them how to eat healthy without spending a lot more money. They think that, if they don't eat rice and beans, they're going to spend super money, and they don't. But they need to be educated. The resources for my patients, low income population, are very scant. Like, for example, for medical patients, they have plans, and the plan provides nutritional counseling over the phone only. Like, and then they do a follow-up maybe in a month, like, 15 or 20 minutes consultation over the phone with a nutritionist. I don't think it's enough. These kids needs to be seen more often. It needs to be involved, the parents too. What are they gonna buy in the grocery store? How they're gonna prepare the meals? A 10-year-old kid doesn't pretty much have that much say in the family. So that is a significant problem, is the access. Mental health is a big problem. 15% of the consultations are related to behavioral problems. You name it. ADHD, ADD, learning disorders, behavioral, like they don't behave, oppositional defiant disorders. Medical doesn't allow us primary care physicians to put an authorization for these patients. So we have to send them to these type of clinics, and those clinics are run by interns of students that are there for very small period of time. So to resolve some behavioral issues, depression, for example, in teenagers, you need a really close relationship with your therapist. And these kids get a therapy for 3 months or 2 months, and then they get another therapy, and then so it's pretty random. That they get one person that will treat them and get to know the family and all the challenges that they have. We have a lot of gangs that fight, and we have some drive-by shootings in the last maybe 4 or 5 years. I think 2 or 3 kids died, teenagers, and we have a lot of drugs, and especially in junior high. And because of that, when the kids from elementary school has to go to junior high or high school, the rate of re-enrollment has been declining in the last 10 years, up to the point, so people, elementary school, let's say 6th grade, the parents look for other districts to go, or private schools. So much so that this year in June, junior high is gonna close. And the students are gonna stay in elementary schools until 8th grade, and then they're gonna transfer directly to high school because they don't have enough money to support the intermediate school here in Duarte because of all the problems and the decline of the re-enrollment. I'm seeing second generation means my patients are having babies and they're bringing the babies here. So it's very close. It's family, sort of a family model of healthcare. They're part of the family, and then we'll try to help them along the way.
In the last year, Duarte has reduced crime by 14%. Multiple nutrition programs have encouraged healthy eating habits and exercise to reduce diabetes and obesity. Youth programs and recreational activities work to keep kids active and off the streets. Duarte is bettering the community through its involvement with the youth. The community, healthcare workers, and law enforcement are trying to prevent problems before they occur. They are working hard to reduce obesity, poverty, gang activity, and drug use. It's a good reminder to us as healthcare providers that our job isn't just to fix health problems, but to help prevent them in the first place. This means spending time with the younger population, teaching them healthier lifestyles, and demonstrating how to make better decisions for a lifetime of positive well-being.